Welcome back, everybody, to another deep dive. You're here because you want to learn the latest in prostate cancer diagnosis.
Yeah, that's right.
Specifically, you're interested in how MRI and PSA density are changing the game by helping to avoid those unnecessary biopsies.
Right.
And to do that, we're going to be diving deep into a research article from the British Journal of Radiology.
Sounds good.
It was published in December 2023, and it's titled Risk Stratification of Prostate Cancer with MRI and Prostate-Specific Antigen Density-Based Tool for Personalized Decision-Making.
Wow.
Yeah, it's a mouthful. But basically, it's all about finding new ways to make sure that men are getting the most accurate and personalized diagnosis possible.
Yeah, and that's really what it's all about. I mean, the current standard for prostate cancer diagnosis, it involves an MRI followed by a biopsy,
Right.
even for men who are considered low risk.
Right, and that can lead to a lot of unnecessary biopsies, which of course come with their own risks and anxieties.
Exactly. It's a valid concern for many men.
So this research is really trying to tackle that very problem head on.
Yeah.
And it's suggesting that by combining the information that we get from the MRI with something called PSA density, we can make smarter decisions
Right.
about who really needs a biopsy and who can maybe avoid it.
Yeah, I think that makes sense to everyone.
So before we get too far into it, I think it's important to explain exactly what PSA density is for those who might not be familiar.
Sure. PSA density takes into account not only your PSA level, which is a protein produced by the prostate gland, but also the size of your prostate. So think of it this way. If two men have the same PSA level, but one has a much larger prostate,
Right.
the man with the smaller prostate will have a higher PSA density.
So like concentrating the information,
Yeah.
getting a clearer picture.
Exactly. And that clearer picture can be incredibly valuable when it comes to assessing your risk of prostate cancer.
Now, this study was conducted at Addenbrooke's Hospital and the University of Cambridge, and they tested out this new approach using data from over 2,000 patients who hadn't had a prostate biopsy before.
That's a good number.
Yeah, significant. So I'm curious to hear about the different diagnostic pathways that they evaluated.
Okay. So they essentially created 4 different routes to diagnosis. The first one is biopsy all,
Okay.
which is the traditional approach. Every man gets a biopsy regardless of their MRI or PSA density.
Okay.
The second route is MRI focused. So this one recommends biopsies only for men whose MRI results show something suspicious.
Okay, so relying solely on the MRI findings.
Yes.
That does seem like a step toward more focused biopsies.
Yeah. But then we get to the truly innovative pathways, the 2 risk-based routes. So these utilize both MRI findings and PSA density to determine who needs a biopsy. And the difference between the two is the threshold.
Okay.
One has a lower threshold for recommending a biopsy, while the other has a higher threshold.
So with the risk-based high threshold route, they'd be recommending biopsies for a smaller number of men. It sounds like this is where the potential for reducing unnecessary biopsies really comes in.
You're absolutely right. And what's remarkable is that despite recommending fewer biopsies, these risk-based pathways didn't miss any more cancers than the biopsy-all approach.
So they're potentially sparing men from unnecessary procedures without compromising the accuracy of cancer detection.
Right.
It's a pretty big deal.
It is. And the benefits don't stop there. These risk-based pathways were also better at avoiding the diagnosis of what we call insignificant cancers.
Okay, can you explain what you mean by insignificant cancers?
These are cancers that are so slow-growing that they're unlikely to ever cause any problems during a man's lifetime. They're essentially harmless.
So in those cases, a biopsy and subsequent treatment might do more harm than good.
Exactly. And that's a key takeaway from this research. By using these risk-based pathways, we can potentially reduce not only unnecessary biopsies, but also overdiagnosis and overtreatment of prostate cancer.
And that's where the idea of personalized medicine really shines, doesn't it? Tailoring the approach to each individual man based on his specific risk factors.
Precisely. We're moving away from a one-size-fits-all approach and recognizing that each man's situation is unique.
This is already so much more than just a summary of a research article. We're really getting to the heart of what this means for men facing prostate cancer diagnosis, and frankly, it's pretty hopeful.
I agree. There's a lot to be excited about here.
Now, I know this research used something called PI-RADS scores, which I understand come from the MRI analysis. Could you explain what those are and why they're important in this context?
Sure. PI-RADS stands for Prostate Imaging Reporting and Data System. Essentially, it's a standardized scoring system that radiologists use to report the findings of a prostate MRI. The score ranges from 1 to 5, with higher scores indicating a greater likelihood of clinically significant cancer.
So if I understand correctly, the PI-RADS score gives doctors an initial indication of the level of concern based on the MRI, and then the PSA density helps to refine that assessment even further.
That's a great way to put it.
And this research showed that even for men with a PI-RADS score of 1 or 2, which I assume is considered low risk, the PSA density still provided valuable information.
You're absolutely right. In fact, they found that even with a negative MRI, the risk of cancer went up significantly as the PSA density increased.
Wow, that really highlights how PSA density can add a crucial piece to the puzzle even when the initial MRI findings don't raise any major red flags.
Absolutely. It's all about having as much information as possible to make the best decisions for each individual patient.
So we've covered a lot of ground already, and it's clear that combining MRI and PSA density has the potential to revolutionize prostate cancer diagnosis, leading to fewer unnecessary biopsies and more personalized care. But I'm sure you'd agree that it's important to acknowledge the limitations of this study as well.
Well, of course, it's important to remember that this was a single center study,
Right.
meaning it was conducted at just one hospital.
Mm-hmm.
And while they analyzed data from, a significant number of patients,
You're right.
over 2,000 to be exact,
Right.
it was a retrospective study, meaning they were looking back at data that had already been collected.
Okay. So those factors could potentially influence the results.
Exactly.
And we need more research to confirm these findings in broader populations.
Yeah, it's always wise to approach any single study with a healthy dose of skepticism and look for further confirmation. That being said, the results are certainly encouraging.
For sure. I'm also curious about the practical implications of this research. So let's say you're a doctor and you're seeing a patient who's concerned about prostate cancer. How would these findings change your approach to diagnosis?
Well, for starters, it really emphasizes the importance of shared decision making. It's not just about me as the doctor telling the patient what to do.
Right.
It's about having a conversation, explaining the different options, and taking the patient's individual preferences and values into account.
So rather than automatically recommending a biopsy for every man with an elevated PSA,
Right.
you'd be more likely to consider factors like the size of his prostate, his PI-RADS score, and his overall health before making a recommendation.
Absolutely. And that's where the concept of personalized medicine comes in.
Right.
It's about recognizing that there's no one-size-fits-all approach to prostate cancer diagnosis or treatment.
You mentioned treatment.
Right.
It seems like this shift towards more personalized diagnosis could also have a ripple effect on how we approach treatment for prostate cancer.
You're spot on. Just as we're moving away from a blanket approach to diagnosis, we're also seeing a shift towards more personalized treatment strategies. It's no longer a matter of simply finding cancer and then treating it aggressively in every case. We're getting much better at distinguishing between aggressive cancers that require immediate intervention and slow-growing cancers that might be best managed with active surveillance, which is a watch-and-wait approach.
So even if a biopsy does confirm the presence of prostate cancer, the decision of how to proceed wouldn't be automatic.
Right.
It would depend on a variety of factors specific to that individual.
Precisely. Things like the patient's age, overall health, the characteristics of the tumor itself, and of course the patient's own preferences and values all come into play. It's about making sure that the treatment plan is tailored to the individual, not just to the disease.
That makes a lot of sense. It's all about finding the right balance between effectively treating the cancer and minimizing unnecessary interventions that could have a negative impact on the patient's quality of life.
Exactly. And that's why this research is so exciting. It's not just about changing how we diagnose prostate cancer. It's about changing the entire paradigm of prostate cancer care, making it more personalized, more patient-centered, and ultimately more effective.
It's amazing to see how research like this can potentially change the lives of so many men. In fact, while we've been discussing the overall findings, I'm curious if there were any specific details from the study that particularly struck you.
One thing that really jumped out at me was the breakdown of cancer risk within the different PSA density groups. They looked at men with negative MRIs, those with PIR scores of 1 or 2, meaning their initial MRI results didn't suggest a high risk of cancer.
So these are men who, in the past, might have been told they were in the clear
Exactly.
and didn't need a biopsy.
Exactly. But here's where the PSA density comes in.
Okay.
They found that even with a negative MRI, the risk of cancer increased significantly as the PSA density went up.
Can you give us some specific numbers to illustrate that point?
Sure. For men with a negative MRI and a low PSA density, the risk of cancer was just 1.2%.
Okay.
But for men with a negative MRI and a very high PSA density, that risk jumped to 12.9%.
Wow, that's a pretty dramatic difference. It really underscores how PSA density can add valuable information, even when the MRI findings are reassuring.
It does. And they saw a similar trend in men with PI-RADS 3 lesions, which are considered indeterminate, meaning the MRI results aren't conclusive. In that group, the risk of cancer ranged from 10.5% in the low PSA density group to 33.3% in the very high group.
So PSA density helps to clarify the picture even when the MRI findings are a bit fuzzy.
Precisely. It helps doctors to better identify which men truly need a biopsy and which men might be able to avoid it safely.
Now, we mentioned earlier that this study was conducted using data from both the PI-RADS v2.0 era and the PI-RADS v2.1 era.
Right.
Can you explain what that means and whether there were any significant differences in the findings based on which version of PI-RADS was being used?
Sure. As with any medical tool, PI-RADS is constantly being refined and updated to improve its accuracy. PI-RADS v2.1 is the more recent version, and the researchers wanted to see if there were any noticeable differences in how it performed compared to the older v2.0 version.
And we're there.
There were some subtle but potentially important differences. For example, in the PI-RADS v2.1 era, they saw fewer cases of negative MRIs with high PSA density values being classified as intermediate or low risk.
So it seems like the updated scoring system might be helping to further refine the risk assessment process.
That's what the data suggests. Of course, more research is needed to confirm that, but it's an interesting observation.
It really highlights how the field of prostate cancer diagnosis is constantly evolving, always striving for greater accuracy and precision.
Yes.
And that benefits everyone involved, both doctors and patients.
I completely agree. It's a testament to the dedication of researchers and clinicians around the world who are working tirelessly to improve the lives of men facing this diagnosis.
Speaking of improving lives, one of the things that's so exciting about this research is that it opens the door to a whole new conversation about personalized treatment for prostate cancer.
Right.
We've talked about how this approach can help to reduce unnecessary biopsies, but I'm curious to hear your thoughts on how it might also lead to more tailored and effective treatment decisions. It feels like we're moving away from the idea that all prostate cancer is the same and needs to be treated the same way.
Yeah, you're absolutely right. We're recognizing that prostate cancer is not a monolithic disease. There's a wide spectrum of aggressiveness, and the treatment approach needs to reflect that. For some men, especially those with slow-growing, low-risk cancers, active surveillance might be the most appropriate option.
Oh, okay.
This means closely monitoring the cancer with regular PSA tests, digital rectal exams, and possibly repeat biopsies, and only intervening with treatment if the cancer shows signs of progression.
So active surveillance is about avoiding unnecessary treatment and its potential side effects,
Exactly.
while still keeping a close eye on things.
Exactly. It's about finding the right balance between being proactive and avoiding overtreatment. For other men, particularly those with more aggressive cancers, treatments like surgery or radiation might be necessary to prevent the cancer from spreading and causing serious health problems.
I imagine that making those treatment decisions can be incredibly complex, both for doctors and for patients.
It can be. There's no easy answer, and that's why open and honest communication between the doctor and the patient is so crucial. It's about having a shared understanding of the risks and benefits of each treatment option and making a decision together that aligns with the patient's individual circumstances and values.
And I imagine that this shift towards personalized treatment is only going to become more important as we continue to learn more about prostate cancer and develop new treatment options.
Absolutely. The field of prostate cancer research is incredibly dynamic, and new discoveries are being made all the time. We're developing more targeted therapies that are designed to attack specific cancer cells while minimizing damage to healthy tissue. We're also getting better at predicting which cancers are likely to respond to certain treatments, which helps us to further personalize treatment plans.
So it's a really exciting time to be in this field. It sounds like we're on the cusp of a new era of prostate cancer care.
I truly believe we are, and this research on personalized diagnosis using MRI and PSA density is a significant step in that direction. It's giving us the tools we need to make more informed decisions, both about who needs a biopsy and about how to best treat the cancer if it's found.
This deep dive has been so informative. I feel like I've learned so much, and I hope our listeners have too. But before we wrap up, I want to circle back to something you said earlier about this research being a call to action.
Uh-huh.
What advice would you give to our listeners who are concerned about prostate cancer?
Stay informed, stay engaged with your health, and don't be afraid to ask questions. Talk to your doctor about your individual risk factors for prostate cancer and discuss the pros and cons of prostate cancer screening. If you do decide to undergo screening, ask about the use of MRI and PSA density in the diagnostic process. The more you know, the better equipped you'll be to make informed decisions about your health.
Excellent advice. Knowledge is power, especially when it comes to something as important as your health. And if today's deep dive has sparked your curiosity, I encourage you to keep digging deeper. There's a wealth of information available online and through reputable organizations like the American Cancer Society and the Prostate Cancer Foundation. You can explore the specifics of PI-RADS scoring, delve into the different types of prostate biopsies, or even research the latest advancements in prostate cancer treatment.
And remember, every man's situation is unique, so it's important to talk to your doctor about what's right for you.
Well said. As we wrap up this deep dive into the world of personalized prostate cancer diagnosis, I'm left with one final thought. Now that we have these incredible tools for more precise diagnosis, how can we continue to improve the personalization of treatment? How can we ensure that every man receives the care that's best suited to his individual needs, his tumor characteristics, and his personal values? That's something worth pondering.
It is. The future of prostate cancer care is all about precision and individualization, and that's a future we can all be hopeful for.
Thank you for joining us on this fascinating journey. Until next time, stay curious, stay informed, and take charge of your health.